So are there going to be any changes in 2017? Hi, I'm Wendy, and this is my husband, Tripp Jordan. He is founder of Medicare for Her, owner of Jordan Retirement Solutions, and nationally recognized speaker and publishing contributor. And today we're going to talk about the question that Ruth is asking. Are there going to be any changes happening in the upcoming year in 2017? So, great question. Do you think she means like original traditional Medicare or with the plans or?
Right. Yeah, I'm thinking she means original Medicare.
Okay.
And does it affect any of the plans? I think she's kind of asking
Good
both
point.
there.
Okay.
I think Ruth is the nice young lady that I've got an appointment with next week.
Okay.
From what I remember.
Yeah.
So, yeah, she's attending my workshop. So.
Well, cool.
Good. I'll talk to you, Ruth. So 2017, there are a couple of major changes. Number one is the Part B as in boy, deductible for original Medicare is now $183.
Okay.
Before it was $166.
Okay.
So that's the biggest change as far as, now of course Part B, that deductible will be affecting doctor visits or x-rays, outpatient type things, not inpatient hospital. So that $183 is affecting plans G, D as in dog, and N as in Nancy as far as Medicare supplements go.
Okay, question. Part B, is that what you told me is deducted from most people's Social Security checks?
No, that's different.
Oh,
Yeah,
that's something different.
Right.
Okay. So Part B is...
This is original Medicare's Part B.
Okay.
Yeah.
And people pay for that?
Correct.
Okay.
Yeah.
And that's what's going up?
That's right.
Okay.
That's right.
I'm thinking of the monthly premium on that.
Exactly. Yeah. So
people pay for the monthly premium of Part B.
Right. Exactly. So for example, I've got a lot of people on what we call Medicare Supplement Plan G.
Right.
And before, in fact, as of this making of this video, the deductible is currently $166.
That's right.
Once that's met, let's say you go to the doctor 2 times and it's $83 a piece or whatever it ends up being there to total $166, which that would be $166. Once that deductible is met one time in the calendar year, you're done. Then it becomes essentially a Plan F. So a lot of times people will write in or call and go, hey, I think that Plan F is essentially going to be cheaper, but don't be fooled. The Plan F is just absorbing and paying that deductible for you. And also they add an administration fee. I call it a convenience fee.
Oh.
So you're paying for that for really nothing.
So they basically kind of jack up the monthly premium to offset not having a deductible.
Exactly right.
Same way that the retail stores, ladies, raise their prices and then put them on sale and make you feel like you're getting a good deal.
Yeah, exactly.
Maybe something you can relate to.
But again, so starting January the 1st, that deductible will now be $183 instead of $166. Okay. So some people go, well, I'll just switch to that Plan F because it'll make economic sense. But let me give you an example, which is a real life case study from a lady I talked to the other day. She was actually paying, let's see, I'm trying to think. No, we were saving her $800 a year, but now she's got that increase in the deductible there. So she still comes out so far ahead with a Plan G, even though that deductible is going to be going up $17 a month, that it wouldn't make sense for her to stay on a Plan F. Why would you?
Right.
Again, Plan F, don't be fooled. They're paying the deductible of $183 for you starting in January, plus they're charging you a convenience fee of doing that. Most of my clients, I think, are smart enough to know I can pay that on my own and save another $600-700 a year, even after the deductible is taken into account.
Right.
So.
But it doesn't mean, for those of you who are watching this and think, I don't care. I don't care if it's saving me any money. I just am adamant about not having a deductible. I just absolutely don't want a deductible, even if it's cheaper, more economical.
Right.
Then you can still go with the Plan F. That's not a problem.
It's still the most popular plan. It's some people call it the Cadillac of plans. Spoke to a lady the other day, explained to her the difference in Plan F, Plan G, the deductible. She's still coming out ahead with the Plan G.
Right.
Didn't want it.
Right.
And I'm not going to make her take it. She said, I don't want any deductible. I don't want to walk out of a doctor and them say, hey, do you have a deductible? And me say yes. I want to say no every time. I said, great, Plan F will be fine for you. switched her from a carrier that she had to another one, saved her $38 a month. From Plan F to Plan F, she stayed on the F, and it was still a good value for her, so no problem.
So it's really whatever's most important to you. And just a side note on the Plan F, and we cover this in our workshop that we do, but there is some recent legislation that was passed, and that Plan F, as of right now, unless Trump changes things, is going extinct in a couple years, 2 or 3 years.
2020.
Yeah, 2020.
Yeah. Now, if you're already on a Plan F, you can keep your Plan F.
That's right.
But if somebody's aging in and say 2020, in fact, your father might be a great example of that, then he will not have Plan F as an option.
Yeah, I think he turned 65 October 2020, so he'll miss it.
That's right. He cannot get a Plan F at that point.
It has to be January.
So hopefully we made the change on the Part B Medicare deductible understandable.
Yeah.
Now the second change is the Medicare Part D drug plan. D is in dog for your prescription drugs. The deductible now is $400 starting January the 1st, 2017.
Was it lower than that?
It was a little bit lower. A lot of the companies out there that offer the prescription drug plans, some of them do offer deductibles, some of them don't. I'm personally not a big fan of the ones who do charge that $400 deductible. When you're looking at drug plans, what you want to focus on is the total out-of-pocket, your deductible, your monthly premium, and then all your medicines. But good Lord, if somebody throws that initial $400 deductible, that has to be met before the plan will start paying anything at that point. So, two biggest changes: Part B deductible going to from $166 to $183. Part D drug deductible is now going to $400 on some plans, depending on if they built that into their plan.
So some very important updates for you guys to be aware of. Hopefully that answers your question, Ruth.
Yep. But again, that's January the 1st, 2017. So right now you're safe.
Okay.
You're okay for the next, whatever days, however many days we go.
Okay. So if you'd like to learn any more, we also host workshops a couple times a week. There should be a link beneath here that you can register. And other than that, we will see you on the next video.
Yep. See ya.
Take care.
Thank you for watching our video. We hope you enjoyed it and learned some things that you didn't know prior to watching it. If you know anybody that you feel like this video can benefit as well, feel free to share it.
Definitely. And you can click around on the screen and it'll take you to different places where you can connect with us on Facebook. You can visit our website, maybe watch some other videos, and you can even register for our workshop that we have coming up. We'd love to meet you.
Take care.